Hi, everyone. Happy Tuesday and welcome to a brand new webinar with Cosmetic Laser Dermatology. My name is Risa and I'm really excited to be here today with Dr. Sabrina Fabi, and we have a really interesting and unique topic for you today, something we have never spoken about before. So I will just give a few minutes for everyone to join and get situated. As you heard when you were joining, this is recorded. So if you miss it or if you feel like any of your friends would greatly benefit from seeing this, you can always send it to them afterwards. We will send the recording out this weekend. Make sure to stay tuned to the end. So I will go over all the promotions for XOMD and skincare in general. And we also are live. It is really Tuesday, May 20th here in sunny San Diego. So after Dr. Fabi gives a little presentation, we will open up for Q&A. So feel free to add any questions down here in Zoom if you have them throughout the presentation, and we will try to get to as many as possible. So if any of you have tried to book with Dr. Fabi, you know she's very booked up. So this is a great opportunity to ask her a question and get a quick answer. So before Dr. Fabi starts, let's officially begin and I will introduce her. Welcome everyone to a brand new webinar from Cosmetic Laser Dermatology. We are very excited to be here today with Dr. Sabrina Fabi, and she is going to talk about your skin's secret language. Ooh, what does that mean? Well, she's going to reveal the mind-body connection that is transforming skincare and that we now offer at the practice. So if you don't know Dr. Fabi, you must have been hiding under a rock because she has been with us for well over a decade, almost 2 decades now, I believe. She is a board certified dermatologist. She practices, today she's talking about skincare, but of course, Dr. Fabi offers injectables, lasers, body sculpting, vein treatments, and all sorts of cosmetic dermatology, as do all of the providers at Cosmetic Laser Dermatology. So I am very excited for Dr. Fabi to introduce the skincare line to you, and make sure to stay tuned into the end for the promotions. So Dr. Fabi, the floor is yours.
Hi, everyone. And so I haven't done one of these in a while. I always like to kind of present something I think make us think a little bit beyond what we think of today. And for those of you who are my patients, you know that I try to be creative, not just in my combination of injectables, lasers, and devices, but how I approach aesthetic medicine, because in the end, it's an art form. And along that vein, I do a lot of clinical trials. And mainly the reason I'm involved now, have been involved in over 150 clinical trials and have published over 220 papers, is because my passion is to innovate and progress aesthetic medicine. And so that has led me into a topic that I have a lot of interest in right now. I've come to you and presented to you concepts like how to masculinize the face and feminize the face, is ultimately that's what we're trying to really do when we're trying to beautify something. It's not about getting rid of lines and wrinkles. We've talked about perception drift, how to avoid making people look peculiar over time throughout the years. And we've talked about little key takeaways on what you can do each decade so that you can age the best. And so I like to try to bring things to you that are a little new and different. And today I'm going to be covering the connection between the skin and the brain. We talk about the gut and the skin a lot, and gut and the brain a lot, but there's definitely a connection between the skin and the brain, and I'm going to be discussing that and how that even occurs. So when we're in utero, as we develop, we essentially, our brain and our skin, the epidermis, actually form from the same layer. There's 3 layers, and the ectoderm, endoderm, and mesoderm, and the brain and the skin all evolve from the same layer. As a result, they end up sharing many similar neuropeptides like dopamine, serotonin, endorphins, as well as oxytocin. And so this has been something of interest to me, especially as a dermatologist, because we generally see a lot of pathology in the skin that affects the way that people feel about themselves. And so it started making me wonder. The skin definitely alerts the brain when it's in a particular environment, perhaps We'll be talking a little bit about whether you can feel or sense danger. And is it because something's going on at the level of the skin, like your sixth sense, that alerts the brain? And in fact, your skin is a major interceptor of a lot of external stress that transmits many messages to the brain and the central nervous system. And so they're definitely interrelated. I will go through this exercise with you. So if you close your eyes, what makes you fearful? Think about yourself in like a dark alley, hearing someone coming up behind you. Keep your eyes closed. And what do you feel when that happens? You'll notice that perhaps you start to get a little bit of goosebumps. Um, you start to feel a little bit sweaty. Um, you're kind of a little bit more on edge, right? But you start to feel it, in fact, in your skin, which is interesting. So what happens in your skin when you're fearful is that what causes those goosebumps are what we call these piloerector muscles that encompass or surround our hair. And they kind of go up, they erect, and it increases skin conductance and it sensitizes your nerves. So it puts you on edge. And so the first thing that intercepts that feeling of fear is actually your skin. So via the skin, the blind actually can sense danger, which is interesting. And this has been proven and shown. And so this made me do a little bit of research with my partner, Dr. Stephen Diane, who's a facial plastic surgeon, because we started to wonder if those that are blind can feel danger as a survival mechanism because every other sense is heightened, including the sense of touch through our skin. Can they also detect beauty? And we found out that they could. And we published on this. And this was an interesting study. I'll kind of elaborate on it a little bit. We had those that were blind, diagnosed blind, sit in a room, and we had professional models come in the room and out of the room. They would have to sit in the room. They couldn't wear heels, jewelry, fragrances. They had to stay 6 feet away from the blind person. And we also had regular lay people walk into the room that weren't necessarily considered models or extremely beautiful. And we had the blind people rate them, and we had people that were not blind rate them. And what we found was when those that were blind rated those that came in, they actually rated them very similar to the people that were not blind. When we blindfolded those that were not blind and then had the same exercise, people walk into a room, close the door, they couldn't speak, they could only sit in each other's presence, and they could not, again, wear makeup or make noises or anything. Those that were of normal sight but were blindfolded by us ended up rating those people all over the place. They weren't consistent with their ratings. But the blind people, when blindfolded, were consistent in their ratings, which is one of the first studies to prove that the blind can detect beauty. And so this was just the beginning in our exploration of what our senses might be able to tell us that is beyond what has at this point been explained. So there's no doubt that the skin and brain have a connection and that there's an ability to potentially harness that connection. And the way we feel, communicate, and act are really all on a subconscious highway between our skin and our brain. Along those lines, there's definitely an impact that our skin has on our mood as well as our self-esteem. And this is something that we learn throughout residency. Patients that generally have acne, 80% undergo some level of depression. Those that have psoriasis or eczema, about 25% of the time, there's some associated depression or anxiety. And so there are many skin conditions that lead to an impact on mood, which then affects overall self-esteem. And so this made us start thinking, is it because they look in the mirror And when you look in the mirror and you see these rashes or your acne bumps, you feel sad or more depressed about the way you look? Or is it that the inflammation and the changes in the homeostasis of those neuropeptides at the level of the skin, where you have the acne, the eczema, or the psoriasis, it has a certain level of imbalance in those neuropeptides that in itself can affect the way one feels. And that's a different way of thinking that we have been exploring. Now, this is nothing new. We've learned and know that botulinum toxin, your standard Botox, Dysport, Jeuveau, this is a way to modulate the neuropeptides in your skin. In fact, when you inject Botox, it inhibits a neuropeptide from being released, actually a couple of them. And so this has had an effect on decreasing redness, reducing skin flushing, improving acne, and now studies even show that when you inject Botox anywhere on the body, there are signalings that happen, and it's not necessarily through the blood, but pathways that occur where you also feel better about the way you are and the way you are in this world. So it's amazing. You can inject your armpit for hyperhidrosis and you feel better about yourself. And it's not that the Botox went through your blood and had an effect on your brain, but there might be something that's regulating in the skin that's having an impact on mood. And so, with that, as we explored the second brain, which we call it, or our other emotional organ, the skin, we know that other neuropeptides exist. There's serotonin, there's dopamine, there's melatonin, there's oxytocin, there's even endorphins. In fact, I want to say about 20 or 30 years ago in the UK, there was a product that was called the Happy Cream that increased endorphins at the level of the skin. And so these are not necessarily new concepts, it's just a new way of looking at it. And so oxytocin is one of my favorites. Probably my bias is that I was pregnant about 2.5 years ago. And during that time, I became very sensitive to the fact, because those who are my patients and know me know that I really can kind of notice and pick up on the nuances of why someone looks a little bit better than someone else, or why one person in one moment of time looks a little bit better than the last time, or maybe the next time I see them. What is it? And it can be a nuance like your skin's a little bit more hydrated, you look less dry. And so it doesn't have to be big changes like a huge lip or no tear trough to make the difference in why one looks better. And so oxytocin is an interesting molecule because when I was pregnant, and when those who have been pregnant will know that they had this glow about them, that independent of the fact that they couldn't do any procedures because they were pregnant, they still somehow looked better and they looked younger. And that happened to me. And I started wondering, how can I recreate this when my levels are no longer as high as they are at the end of pregnancy and while you're breastfeeding? And so oxytocin is a very unique molecule in that it's available to you. You have receptors for it at the level of your epidermis, the top layer of your skin, but it's also released at the level of your brain in the hypothalamus. And so it's one of those unique neuropeptides, again, that's in both the brain and the skin. And there's a communication, and it doesn't necessarily have to be through the blood. With oxytocin, which is interesting because Mother Nature doesn't make mistakes, its intention is to promote bonding between you and your newborn, but also between one and their partner, whoever they're in intimate relationship with. And so, in doing so, which is really interesting, when we're pregnant, we're in a very hyperinflammatory state. It's considered one of the three most stressful states, likened to either a car accident or even surgery. And so, what is your body doing to control for that hyperinflammatory state? It releases oxytocin, and that level just keeps going up as you gear towards ending pregnancy, at the very end of pregnancy. And so, it's counteracting that inflammatory state. So, we know that oxytocin improves tissue healing because it reduces overall inflammation. So, it's considered an anti inflammatory and antioxidant. So there are receptors for oxytocin at the level of your inflammatory cells as well. And so it decreases inflammation as a result. It's also been found to influence insulin growth-like factor. This might be a little bit more scientific for the purposes of this talk, but this is important because this decreases reactive oxygen species, which ultimately age us. And so it's a natural antioxidant. And so there's no doubt, I think at least, my bias is that there's no one that looks healthier than a pregnant woman. And that's really because of this molecule. So it started making me wonder, is it just in pregnancy? No, you know that people look good when they're in love. You have a glow about you, what's going on, and it's usually because of being in love. And it's a hormone or a neuropeptide or a neurohormone that's considered to be pro-social, promote bonding, and also associated with decreasing social anxiety because it puts you in a more relaxed state and has antidepressant properties as well as heightens sexual intimacy and arousal. And so it's also associated with increasing trustworthiness. So when you have more of this, you trust your partner more, and it tends to make one look more attractive. And so when in love, one is really drunk on oxytocin. And so, is there a way to essentially stimulate this without inhaling it? Because in the drug form, you have to inhale it. But could you stimulate the receptors with something that can mimic the molecule and get the same effect? And so we essentially started evaluating a formulation, and we consulted with many neurobiologists to try to determine if we could get a peptide that could have a similar activation at the level of the skin. And we came to find out that there was a jasmine derivative that out of two of the jasmine plants, that you could create a peptide or extract a peptide that could bind to the oxytocin receptor. And so we wanted to redefine what we put on our skin and ask more of our skincare than just to improve a line or wrinkle. We really wanted to create a moodceutical, something that bypassed just getting rid of the line or wrinkle, although we know oxytocin can make the skin look good, but something that could make us feel better too by leveraging the fact that your skin is your second brain. And so when increasing oxytocin in the levels of if you could increase oxytocin levels at the level of the skin, could you do it with a botanical? Now, there had been in vitro studies in a lab that looked at jasmine and did show that it could potentially bind to the oxytocin receptors. We know jasmine for its delicious aroma, but it has this unique ability to increase one's skin's oxytocin levels. And so how does it do that? Well, there are these receptors, the same receptors when you get a hug or you get a kiss that are activated. There are these piezomechanoreceptors along your Meissner corpuscles. These are corpuscles that sense touch and detect touch. And essentially, the skin transmits that touch through these receptors. And these jasmine peptides being very popular right now, have been found to bind to these receptors and can influence the release of oxytocin in the skin. We decided to couple this with the phospholipid, specifically phosphatidylserine, which has been found to decrease red and brown at the level of the skin and serves also as another anti-inflammatory agent that improves skin barrier. And so, because we knew that these effects could happen at the lab, we decided to carry it over to really confirm whether the effect could be seen clinically in patients. And this is where generally there is a discrepancy in many of the skincare products that you may see at your general retail center. They don't really put the products that you see sold under some type of rigorous testing because you don't have to, as these are not drugs. But because we're physicians and we're investigators and professors and we have a reputation, We wanted to ensure that the product represented and aligned with our brands. And so we did put it under rigorous testing through a placebo-controlled, double-blinded trial. And so here we took 40 women and we randomly assigned them 20 to receive the product in the vehicle formulation, because some things sound really, really good, like collagen, which is a big, you know, craze right now. But just because it sounds really good and there's a place for it doesn't mean that by the time you take it in or ingest it, that it's going to have the effect that you want it to have at the level of the skin. So similar is true with a lot of products. They sound really good in theory, and in a lab or in a petri dish, they may actually work. But then when you put it in a vehicle, because these peptides and products have to live in a cream or in a serum or in a cleanser, it doesn't translate to an effect, either because the vehicle that it's in ends up neutralizing it or deactivating it, or because you don't have enough concentration of the active ingredient to make a meaningful difference, like you saw in a petri dish. And so here we didn't know what we were going to see, but we decided to put half of the folks in just the vehicle and half of the folks in the vehicle of the cream and the serum with the added peptides. And we had them use it twice a day, morning and night. And we followed them for 4 weeks. And at 4 weeks, we crossed over the placebo group into the active group and then followed both groups for an additional 4 weeks. What did we look at? We looked at various different skin assessments because, of course, this is still in the skincare family. We want to make sure that it has a meaningful benefit when it comes to the skin, but we already knew that it would because of the natural effects we know oxytocin can have. But we wanted to know, could it go further, like we know oxytocin can, and also improve the way how attractive someone looks, how confident they look? Can we impact how they may feel in a social environment as far as their anxiety levels? And could we potentially even enhance intimate relationships? So what did we find? 39 completed the trial. Two ended up dropping. One was because of an unexpected pregnancy as early as 4 weeks. And what did we see? Well, there was statistical significant difference. So comparing placebo to active, we saw that the placebo group did not get improvement in these metrics as much as the active group. And that was in skin tone evenness, smoothness, overall sun damage, dewiness, as well as redness and dryness. And I'd probably say the redness, dryness, and evenness were the most notable. Placebo, no significant difference in no category. So it's not like you can attribute the change just because you put a moisturizing cream on. When we crossed over that group at 4 weeks into the active group, at 8 weeks of being on the product compared to 4 weeks of being on the product, those that were on it for longer had a significant greater improvement statistically in evenness, radiance, dewiness, and redness compared to the group that had only been at it for 4 weeks. So that means that, as we know with any skincare product, the longer you're on it, the better. And so these were just some of the subjects in the trial. And this is an example, a beautiful patient. You can see that her dewiness is significantly enhanced. You can also see that she has significantly less redness as well. And that was something that we continuously saw in the trial in every single subject because of that anti-inflammatory, antioxidant effect that oxytocin has. Here's another patient, her skin just looks healthier. And this matters because your skin is your visual certificate of health. Look at how unhealthy someone can look with all that redness and dryness, and look at how much healthier someone can look with less redness and less dryness. And that was another metric we saw. This woman had a lot more improvement in her skin tone evenness, because if you have a lot of redness, especially in patients that have a tendency towards melasma, that melasma can look worse. In this beautiful Asian patient with melasma, you can see when you minimize the redness, her melasma looks a lot less and her skin tone evenness looks much improved. And this is just a patient in my own practice after just being on it for 3 months, looks so much less red from being on the product. This beauty, let's see if it works. You can see the redness improve in this beauty as well after 2 months of being on the product. So the product absolutely has an impact on redness, radiance, dewiness, and dryness. Now that's great, and especially for my patients, there was a thoughtful consideration because I treat a lot of redness and a lot of melasma, and I just like me, my patients have sensitive skin, react to a lot of things. I have personally eczema, and so I have very dry skin, making my barrier more impaired and more reactive to anything that I put on it. So we made sure that the formulation didn't include any parabens, sulfates, or fragrances that we know are common allergic contact dermatitis ingredients. And I also at the time was very focused on what I could put on my skin when I was pregnant and look through the environmental work group, which is a great website that can kind of rate the ingredients that are in your products. And so we went through each ingredient to make sure that it wasn't high or moderately high for any risk of being a carcinogenic or a hormone disruptor, because more and more now we're seeing issues with a lot of products being hormone disruptors, and your skin is your largest organ, and you definitely want to be conscious of what you're applying in it because it's getting absorbed. So with all the fertility issues that I see every day with my patients, I wanted to be thoughtful of that. So probably another reason why people didn't react to it and saw less redness and inflammation. Now, some of the fun endpoints that we saw in the trial that we wanted to investigate were we know that oxytocin can make one or make someone look at others and perceive them as more trustworthy and more attractive. And so it's generally in terms of your partner, the person that you're bonding with. But here we took images of these men and we had the subjects assess them for their level of attractiveness before being on the product and then again at 8 weeks. And what we found was that men were rated as more attractive with those that were on the active XOMD versus those that were on placebo. In fact, being on placebo, only one of the placebo subjects rated one of the men more attractive 8 weeks later. And so attractiveness went up and trustworthiness went up. Now, what about the impression that the people that were on this product had on others? So this is a validated scale um, on overall first impressions that has been used on multiple clinical trials. And what we found was that in 5 out of the 8 metrics, the people that were on XOMD casted a better first impression. And this was statistically significant compared to placebo. Placebo in 0 of the 8 categories did anything go up. So that was notable. And when we took the images of our subjects and then we put them through SurveyMonkey and we set them out to over 2,200 people, random people who decided to take the survey, on average, the people that were on XOMD were rated as looking 3 years younger when images were randomly assigned and people were asked, how old does this individual look? And so they didn't know if they were looking at a before photo or an after photo. And sometimes they didn't even see the same image or the same person twice. Now, we then used validated scales, which we use in a lot of our drug trials called the FACE-Q. These were created by Andrea Pusick, a plastic surgeon out of Canada, who also has affiliation with Sloan Kettering. And so these are very famous scales that are used in our trials to try to determine, does this make an impact for the patient? And here it was interesting. They had an improvement in pretty much every metric. But what was statistically significant was that they had less social anxiety in social settings in as early as 4 weeks when compared to the placebo group. Placebo group still felt a little anxious. Now, when we looked at skin quality, metrics that improved in as early as 4 weeks, everyone felt their skin looked radiant when they were on the active, and that continued until they finished the trial. People that in as early as 4 weeks, about 70% started to want to recommend it to a friend. That got up to 90% by 8 weeks. At 4 weeks, people started already noticing improvement in skin tone evenness that just continued to improve at 8 weeks. And more importantly, people felt up to 86% felt more confident at 8 weeks. And so, in the end, from anything that I do, at least in my practice, even if someone's mathematically perfect, if they don't feel confident in their own skin, then really it's not as gratifying of a treatment. Because in the end, that's why I think we do what we do. Now, some of the other juicier stuff. We looked at sexual satisfaction because we know that oxytocin has been associated with heightened intimacy with your partner. And we also used another validated scale. And what did we find? We found that those that were on EXO after 8 weeks showed statistical improvement in 90% of the categories where the placebo showed zero. I mean, to have a zero placebo effect, I mean, that's pretty impressive. So, in probably more than any other metric, the sexual satisfaction went significantly up. And then the partners of the people that were on EXO also noticed a statistically significant improvement in their intimate bonds with their partner than those that had a partner that were on the placebo. So almost triple blinded. So, in conclusion, I think that the future of skincare is something that is more than just about appearance. It's something that can enhance your confidence, your self esteem. And that should really be the goal from any aesthetic procedure or intervention that one aims to get. Because it's not about getting rid of a line or a wrinkle, it's what's going to make the person look the prettiest or the most handsome for them without distracting or looking unusual, and so that they can feel the most confident in their own skin, which ultimately promotes pro-social interactions and makes us more confident in social environments and in the way that we interact and move in this world. So, with that, this is really the skin brain connection. I encourage you, if you haven't, to add questions in the chat box. And this is really the science behind XOMD, which is a skincare line or moodceutical that is now available at Cosmetic Laser Dermatology.
Yay. Thank you so much, Dr. Fabi. All right, so I will take down your
Yes,
screen,
please.
and now you guys have the opportunity to ask Dr. Fabi any questions. So feel free now to go in and pop any questions into the Q&A feature. We'll get through some questions, and then I'll give everyone their code for your special offer.
Yes.
So here's a good first question. So can you combine XOMD with other skincare that you've recommended in the past?
Yes, so we cross-checked each of the ingredients from our skincare line with others, such as retinols or AHAs, BHAs, to make sure that there'd be no interactions. Because in the end, I'm a dermatologist. I make a lot of skincare recommendations, and some of my patients are even on prescription medications. And there isn't. It doesn't alter the pH of your skin, which is ultimately one of the things that one would be worried about that would potentially have an impact on the stability of any other product that you would put on. In fact, I even have my patients who can't tolerate a retinol so well, even blend it with the moisturizer. Or some people are now doing sandwiching, where they put the moisturizer on first, then they put on their retinol, and then they put on the moisturizer afterward.
Well, that's a good analogy. Is this a day and night cream, or is it only for day or night?
So it was developed to be used day and night. I find that sometimes some of the moisturizers that are intended for night almost just sit on the skin. They're probably a little bit more lipophilic, not making them very amenable to being absorbed well. So the intention here, we know that oxytocin increases the water content of the dermis, which is the second layer of your skin. So you can have moisture without having to put a barrier on the skin and not let it breathe necessarily. So you can create moisture many different ways, not just by covering the skin, but also by just drawing more water into the skin. Some hyaluronic acids work like that, topical products. The more sophisticated ones can do that well, but the less sophisticated ones, HH is vaporizes and it doesn't always draw in water for a long period of time. So we wanted to formulate it so that it could increase dermal content, but you apply it at night and you wake up and you still have a good amount of moisture to your skin. So that was important. And that's what makes it good for morning and night. And that's how we studied it in the trial.
So it sounds like it almost takes the place of serums.
Well, there's a serum as part of it. So there's a serum and then there's a moisturizer. The serum does not have the glycerin and it doesn't have um the this it doesn't have there's one other ingredient which I want to take a look at. I want to say it's like butylene glycol. It doesn't have that, so it doesn't make it as heavy as your moisturizer would be. Glycerin is an excellent humectant, right? Um, and so the serum can still, to a degree, create some level of hydration, but not as much as the moisturizer. The moisturizer draws in water at the dermis, but also has a level of humectant on top because of the glycerin.
Interesting. So is oxytocin actually in it, or is it a plant-based mimicking it?
It's a plant-based mimicking it. It's a
Mm.
plant-based peptide.
So does layering a few different products on the face during a skincare routine change the effectiveness of the products? That's a great question. I've wondered that before too. Like, do they conflict with each other?
We haven't studied it that way, nor has any other skincare company ever
Mm.
studied their product in combination with other products, right? It would almost become a little too complicated. Most product lines want to study and make sure that their product is efficacious on its own. Otherwise, you would never know which variable is accounting for the difference that you see. But in clinical practice, because now I've been recommending it to my patients since we launched at the end of January, many of my patients still combine it with their antioxidant, their CNE ferulic in the morning, or they'll combine it with their illuminate if they have a lot of pigment as
Mhm.
well, or they're with their growth factors. They'll use their growth factors first, like the TNS Advanced Serum, and then they'll use the XOMD Intoxicate Serum and then Arouse Moisturizer. So it's definitely something that can be incorporated into anyone's skincare regimen.
Got it. So this question kind of goes along with that. Does it contain vitamin C, or should you add a vitamin C into this regimen?
Well, in theory, the whole point is that oxytocin is a standalone antioxidant, um, because that's what its intention is in the human body. So that's why we secrete it also to a degree to counteract the stress of pregnancy. And so you could, if you wanted more of an antioxidant effect, especially if you're a runner, you're outside a lot, exposed to a lot of particulate matter and pollution, or you're outside, you're a golfer. We know that those that like are in golf courses a lot are inhaling a lot and taking up a lot of injury, like external environmental stress that can increase reactive oxygen species at the skin level. If that is happening, then it doesn't hurt to have another layer of an antioxidant to support you.
Got it. It's so refreshing because sometimes we see these influencers on social media that layer like 12 products every day. But this seems like, it's so simple. You're saying we can get these great results with just the cleanser, the serum, and the moisturizer, right?
Well,
We don't need to
yes,
overthink it.
because I have to tell you that I am not, there's two different, there's people that love their 7 or 12 step skincare regimen. I have unfortunately never have been that person. I am a more heavy device procedure, based person, because I know that that's going to give me 80% of my result. But I do believe that the topicals that you put on every single day can either add to your benefit of your procedure or they can affect it in a bad way, right? And so the intention was to create something that was simple, that wasn't going to disrupt also the results I was getting from the lasers and procedures I was offering my patients. And sometimes what you can get over the counter, like if you're spending so much on these procedures, maybe just making the little bit of investment, it pales in comparison to the cost of these procedures so that you can maintain the results. I think it's worth it and it doesn't require 7 to 12 steps.
Yeah, it certainly sounds a lot easier because many of us are quite busy in the
Well,
morning and night.
traveling for me, I'm like, half the time I'm not at home, so I need something that's minimal steps.
Absolutely. Absolutely. All right, here's a good question. So, can I use this product and how effective is it if someone has rosacea or folliculitis? Can it have a positive effect on those conditions?
So rosacea, there's many different kinds. So that would be like, I need to see you to diagnose you because there's erythrotelangiectatic, there's acne, a form, there's rhinophymatous forms. So I don't know, in general, what kind. We didn't specifically look at folks that had rosacea in the trial, but those that had redness, as you saw in the photos, those subjects did better. And in practice, my patients that are coming in for IPLs or pulse dye lasers for their erythrotelangiectatic form of rosacea, this is my product line of choice afterward.
It. So, are you able to apply it to your neck and chest also, or and
I
around the
do.
eyes?
I put it on.
Right? If we can afford it, put it on our whole
Yeah,
body.
well, the pump, just it's of interest for, people because I've learned a lot in the development and manufacturing of a product. The manufacturer can decide how much they want to come out and be delivered with each pump. And
Mm,
so one pump of the serum is actually generous enough to definitely cover the face, and depending on the size of the face, you could extend at least to half of your neck. Um, if some people love to bathe and stuff and they put it on their chest, then you'll probably need two pumps. For the moisturizer, one solid pump using your two fingers, because it's a product that, gosh, I don't have, let me see, I actually have it right here. But a lot of the products that you use there are studies that dermatologists, of course, do that show that if something is open and you leave it in your bathroom counter, you have about 1 million microbes in your bathroom counter. And so that those microbes start to grow and populate in your product. And that's probably the reason why people have reactions to their product over time. So we made it so that it was closed as an airless pump so that it wouldn't happen. But when you press on it, it's one pump is generous enough to cover the entire face as well as the upper neck. So that was intentional. It's not like a small serving.
got it. And is the active ingredient in both the serum and the moisturizer, or is it mainly the serum and the moisturizers for moisture?
No, the active ingredient is in both. It's the additional ingredients. For instance, in the serum, there is there's a honey tree extract that only comes from a tree in Korea that has tannins in it that has been found to decrease sebum production and decrease or improve skin tone evenness and decrease pigmentation. So that's something that's uniquely in the serum that is not in the moisturizer because we wanted that tannin dose to be applied so that you don't get an increase in sebaceous production and make your skin oily. We didn't want that. Um, we wanted dewiness and radiance, but we didn't want oiliness where you look like you want to blot the person's skin. In the
Definitely.
moisturizer, we have an apple extract as well as a watermelon extract that's not in the serum, both of which have been found to also promote moisturization effects and serve as antioxidants. So those are ingredients that are not found. Both have the OX factor, the jasmine peptides and caripeptides, but those are the unique ingredients that you find in the serum versus the moisturizer.
Got it. How about acne scars? Scars. Does it help with them?
I haven't found a topical maybe that really helps with acne scars, if I'm being honest. Perhaps a prescription grade tretinoin. But otherwise, in my experience, it's really devices and injectables that help scars the most.
Okay. Well, since you offer those treatments too, do you want to clarify more of what you would recommend for acne scars?
It depends on the acne scar. So there's various different kinds. There's rolling scars, so scars that improve when you pull the skin away in an upward vector. There's boxcar scars, almost um, kind of, they cut into the skin almost a little bit more square. When you pull back the skin or tent the skin, they do not go away. And then you have ice pick scars, where like they're, as the name almost implies. And so ice pick scars are generally a little bit more amenable to certain peels, chemical peels. Rolling scars are the most amenable to both the injectables and the lasers. And depending on their depth, you might even need subcision. And then boxcar scars are probably the most frustrating. But again, very similar techniques would be used like you'd use for the rolling scars, just with not as much efficacy.
So interesting. All right. Does anyone else have any final questions? If not, we have your special code ready for you all. So I will pop that in right now. And while I am doing that, if you have anything else, feel free to let us know. Otherwise, let's talk about the promotions. So right now, all of you amazing people that joined our webinar tonight, you are all eligible for 10% off your first order of ExoMD, which is amazing. And I'm going to put in a code in the chat that is only for you guys here on the webinar. And to make sure that it's really safe for you and it's not going to be in the recording that everyone else sees, I'm going to pop it into the chat. So can you guys all, anyone send me a message if you don't see it and you need it? Oh, some people are asking how much it costs. Maybe we could tell them really fast.
Yes. So the serum is 188.
Mm-hmm.
The moisturizer is 155, and the cleanser, I want to say it's either 48 or 49.
48.
And then I also, for the month of May, if you don't use the 10% off, but you buy or you try the XOMD for the remainder of the year, you get 10% off your skincare purchases here at Cosmetic Laser Dermatology.
Yes. So did you guys hear that? You have two options today. You use 10% off today, or you just purchase XOMD, you try it this month, and you get 10% off. Did you guys hear that right? All skincare, any and all skincare, not just XOMD, any brand that you buy from us at CL Derm through the end of the year, which is a huge, huge potential saving. So I highly recommend you guys all go for that one and you purchase the XOMD so you get the 10% off. But either way, we are happy to accommodate you. So I just want to make sure, did you guys all see the code that I put here in the chat for you? If anyone didn't, let me know. Finally put in the code again. Here you go. All
And
right, if anyone needs it. Oh, here's a good question. So do we have to buy all of it or can we just do the cream for the discount?
I think you can do any
Yeah.
of it, right,
Yeah,
Risa?
you could just
Yeah,
buy the cream and get it too.
exactly.
But like Dr. Fabi said, some of the great ingredients are only in one and not the other. And I'm pretty sure that Dr. Fabi would say she designed it to be used as a regimen.
We did design it to be used as a regimen. That's why we didn't double up on the same ingredients in both products. But it's you can always try one and then try the other, at a different point, whatever
Mhm.
works for you. But I do want to thank everyone for joining us this evening. It means a lot to have your attention. I know that there are many things that you can do on your Tuesday evening. For my patients that are on this call, it's such an honor and pleasure to be your doctor. And thank you for your trust. It means a lot to me.
Absolutely. All right, a few more questions are just coming in. I was answering them. Oh, here's a good one. How long do the products typically last?
Great question. So it's generally 6 weeks. Some people can extend it out to 8 if they're kind of doing like a half pump. Other people like to do 2 because they're just excessive and they want to put it on their chest, and that's okay. I tend to be that way, but that's the reason why I made it sure that the pump delivered a fair amount with one pump and that the pump with the moisturizer did. So I haven't seen it ever last less than 1 month. I'd say about 6 weeks, and then those who are just a little bit more judicious with their pumps, 8. And that's
Okay,
pretty standard in skincare.
that's really helpful. All right, so please the code again. All right, here it is. Can we mail products? Absolutely, we can mail them anywhere, all over, wherever you are. We can mail
All
them
over
to
the
you.
US. We have, let me tell you all what the website is. so that maybe Risa, we can put that
Yeah,
in.
I popped the link in for the website and we offer free shipping and we can ship anywhere in the country. So feel free to order. And then also, just in case you're having trouble with the code and you didn't see it in the chat, we are going to be emailing all of you, everyone who's still here, the attendees, will email you the recording with your special code. And then everyone that wasn't here will get a different email without that special code.
Then also just to a little plug, we're going to have our national educator here at Cosmetic Laser Dermatology this Thursday from 8 to 12. She is an esthetician that lectures all over the country and has been doing so for the last 25 years. She's also published a book on skincare. And for those that purchase on that day here in the office, you'll get a free travel kit.
That's amazing. So that's in 2 days on the 22nd?
That is in 2 days, Thursday.
Amazing, guys. All right. So for those of you that are here now, please mark your calendars and come in. What time will that be?
8 to 12.
8 to 12. Okay, guys. So definitely swing by then. That's a great opportunity. You can still use your code from the webinar, or you could just make the purchase and then you get all the discounts for the rest of the year. And we're really doing that because we really want to give you guys the opportunity to try something new and not be nervous about it and feel confident that if just in case you don't like it, you can go back to ordering whatever you would like to. And someone's clarifying, so I can order this once and then I get a discount on SkinCeuticals. And yes, that is the answer. If you think you want to go back to your SkinCeuticals, that is fine. If you want to do a combination, that is fine. So beautiful. Well, thank you all so much, like Dr. Fabi said, for giving us your time. I know everyone has so much to do, and we appreciate you spending some time with us. Thank you, Dr. Fabi. You saw a big day of patients and procedures all day, and then thank you for educating us and sharing all this knowledge with us. It's so interesting to learn about this, not just a new skincare line, but a new vertical, a whole new type of skincare that's out, this mood ceuticals.
Yes.
So thank you so much. Thanks everyone for coming. And please, we look forward to seeing you at Cosmetic Laser Dermatology soon and hopefully on Thursday for the pop-up event for XOMD. Bye,
Bye,
everyone.
guys. Have a good night.